Hello, my name is JD. I am the owner and founder of breathsounds.org. Sounds bigger than it really is. It's no big deal, really. This is the first of what I hope to be regularly scheduled brief video lectures on things that I may write about, things I have already written about. Some people would rather listen to me babble for a few minutes than read the paper. Others would rather read the paper. Everybody has their own way of learning. It's part of what makes us, us. Today's topic is a simple one, room tension. It's an important one. Room tension is exactly what it sounds like it is. It's what I like to call the Triad of Chaos. It is the level of stress, noise, and confusion in the room during a medical emergency. As respiratory therapists, we are the airway managers, whether primary or secondary. If we are at a facility where part of our responsibility is to be the primary airway manager, then we're at the head of the bed. We have control of that airway, and we're trying to manage that airway, and we're preparing to put a tube in, and quite possibly might be trying to save a life. Our team players have to be able to respond to everything we need, everything we ask for, everything we say is going on. The higher the stress level and confusion level in the room, the less likely that is to happen, and the more likely we are to make mistakes. These are the scenarios when we are most likely to make mistakes, and we add increased risk to our patient. That's never a good thing. So this is what I do to avoid this triad of chaos, or at least counteract the stress level in the room. And it works almost every single time if you do this every single time. And it's very simple. The more excited and stressful and confusion that's going on in the room by the team players, the quieter and slower I become. It does a little tap dance on their frontal lobe. The side effect is very simple. They have to quiet down and slow down to hear what I'm asking for, because they know I have the airway. They know that they have to respond to the things that I need that I can't do because I have the airway. And even if it's something simple, whether it's turn the monitor toward me a little bit so I can see, maybe I want the glide scope a little closer. I've got a straight blade on the scope. I use it like a curved blade in my pocket. That's kind of a simple little thing, but it's important to me. We can relax, all right, because we already know in the back of our minds, we've been trained, and most of us have been seasoned. We already know that what we're going to do first, second, third, and fourth. We already know, or at least we should have a physician somewhere on standby just in case things go sideways. So we know we have help, we have other tools we can use, and we have other people that can come in and assist if your patient needs more advanced skills. So we can relax, because one way or another, business is going to get taken care of. I've been teaching this for 25 years. I've taught this to almost every student I've worked with. It works almost every single time if you do this every single time, because your team players will come to expect this behavior of you. And when they walk in the room and they see you there, they know if you're relaxed, they can relax. If you're comfortable, they can be comfortable. No one's allowed to panic until I do. I say that a lot. Everybody gets a kick out of that, but there's a lot of truth to that. If I'm not upset and I'm not panicking, then there's no reason to panic. Everybody can take something from that. We are the best at what we do. Please believe that in your heart. Take pride, be proud, and above all, be safe. Thank you for watching. I'll see you next time.